Hey, good morning. I'm Patricia Murphy. It's Tuesday. This is Seattle Now. Fertility care like IVF is very expensive. And here in Washington State, insurance companies aren't required to cover it. Coming up, we'll talk about the financial burden that's putting on families trying to have children. But first, let's get you caught up. Summer in Seattle. It isn't over yet, but the days are getting shorter. Tomorrow will be the last 8 p.m. sunset of the year. So soak in the long days while you can, because we won't see another sunset that late again until April. The team representing Washington in the Little League World Series took their first loss over the weekend. On Sunday, Soundview from Tacoma suffered a 5-0 shutout against Nevada. Now they're in an elimination bracket. They'll be playing a winner-go-home game at noon today that will be televised on ESPN. And finally, happy 110th birthday to the National Park Service. To celebrate 110 years of preservation, education, enjoyment, and inspiration, national parks are free today. It's a great excuse to visit Mount Rainier or Olympic National Park if you haven't already. North Cascades National Park is fee-free year-round. Check back for more headlines on tonight's episode of Seattle Now. In Washington State, fertility treatment isn't typically covered by insurance. That means couples trying to have children are making huge sacrifices to pay for treatments like IVF. Half of states in the U.S. require insurance companies to cover at least some fertility treatments, but not Washington. Seattle Times reporter Alexis Wiesand has written about how that's playing out for couples here. Alexis, really appreciate you coming in.
Yeah, thanks for having me.
So the number of people using fertility treatments has been growing in the U.S., especially over the last decade. What's behind that?
There's a couple of things. I would say that the main one is that biology and economics are working against each other. So across the nation, people are delaying starting their families until later in life. And that's because younger generations are dealing with a lot more debt. They're dealing with high housing costs. They're dealing with rising prices of everyday essentials like gas and food. And so it makes it more difficult to afford a whole other human being to take care of in your life when you're struggling to take care of yourself. And people are waiting until, sometimes they're mid to late 30s. And so it becomes more difficult. And so later in life, those couples often need help getting pregnant, but that care is very expensive.
You report that half of U.S. states require insurance companies to cover at least some form of fertility care, but not here in Washington. Why is that?
The state of Washington took up this issue a little after the pandemic started, around 2021, 2022. Representative Monica Stonier of Vancouver first submitted a bill that proposed covering, I think it was 4 rounds of IVF, covering fertility preservation treatments like freezing your eggs, so that we could start following this trend that we're seeing other states take part in. The problem was the Office of the Insurance Commissioner did some math and showed how much this would cost per member per month across any kind of insurance plan. And it ranged from about $1 to about $5 more a month. And so that was difficult for lawmakers because they see everything else that is costing people more right now, and they don't want to add something on top of it that they might argue only benefits a small group of people. And then the other issue is that the state is dealing and has been dealing with for a while this multi-billion-dollar deficit, and the state has to come up with money for this care for its own employees. And that's much more difficult to do in today's challenging budget environment in the state.
So Washington has opted not to require coverage for this.
3 times in a row.
Okay. All right. Fertility care, as we've been talking about, is costly. If people have to pay out of pocket, how much money are we actually talking about here?
It really depends on the person's journey. Usually what happens is people start trying intrauterine insemination, IUI. That can cost a couple $1,000s. That's typically not covered by insurance. People try fertility drugs as well. That can be very expensive and cost several $1,000s. But the most common treatment, the most successful treatment, is arguably in vitro fertilization, or IVF. That is really where these families are struggling to afford care. One round of IVF can cost between $15,000 to upwards of $30,000. Also, you often need several rounds of IVF, which is where you take an egg and create sort of an embryo outside the body and then put it back into the uterus. You need to do that several times because it only works maybe 3, 4 out of 10 times. That is maybe $60,000, maybe $90,000. It can really add up very easily.
In your piece, you report how couples are scraping together every cent they can to pay for this kind of fertility care and, like you said, going into debt. Tell me about one of the couples you wrote about who did go through with this.
I think the couple that stands out the most to me is Riley and her wife. They're Bothell residents. They both work in healthcare, and they've been married for a while, and they wanted to start trying for a baby. They knew that it would be more challenging for them because they are a same-sex couple, but they did not know quite how challenging this whole process would be. I mean, it took years for them. When they first started on this journey, they had no idea how much it would end up costing them. They started with IUI, and that didn't work. And they tried again and again, and that cost them a couple $1,000s out of pocket. And then they had to move toward IVF. Their IVF cost them $25,000 out of pocket per round. And even though they had savings, that was a lot of money. That's a lot of money for any family. And they had to reach out to their friends and family and ask for help via a GoFundMe. That's a very common thing that you'll see on GoFundMe, actually. And they really had to pinch pennies. And it was a really difficult experience for them because IVF and trying to become pregnant with medical help is already an exhausting and emotional experience. And so they had really tough times where there would be tears, there would be stressing over bills. And that's all on top of trying to get pregnant and being poked and prodded and made uncomfortable, and sometimes feeling like your body is failing you in a way.
Eventually, though, they did have a baby.
Yes, they had their baby just a couple weeks ago, actually. Both Riley's wife and the baby, who they call Peanut or Little Shrimp, they're very healthy and they are living in total bliss right now. They worked so hard to get here, and to have that moment finally come, it's a huge deal for them. But at the same time, you know, I have been in contact with Riley, and she's rocking her little Peanut, but she's telling me that even though she's so happy that her baby's here, she's really worried about trying to afford this all over again because, like many families, Riley and her wife, they want a second baby. They want their child to have a sibling. That's always been part of their dream. But to make that possible, that means potentially spending $64,000 out of pocket again because, again, even though they both work in healthcare, they don't have this coverage. So they're going to have to figure out how to do this journey all over again while trying to afford raising a child in the Seattle area. And that's already really expensive.
Free IVF was a campaign promise that President Trump made. Are there efforts at the federal level to get this covered?
Trump made that promise on his campaign trail. We haven't seen him follow through with it. Trump has proposed encouraging companies to offer supplemental fertility coverage like you would with vision or dental, but we haven't seen anything concrete come out of that. However, Democratic lawmakers, including some of our own from Washington, have proposed time and time again, actually, a Right to IVF Act that would include a nationwide insurance mandate for covering this care. However, Republican lawmakers have knocked that down several times. The Democratic lawmakers say that they are reintroducing that bill this year as well, that legislative package this year as well.
There have been efforts to get insurance companies to cover fertility care here in Washington state. We've had several failures of several bills. What is the status of the push right now?
I talked to Representative Monica Stonier, who is the one who has sort of championed all of these bills in the legislature these last 3 sessions. And she said that despite these failures, she plans on proposing a similar bill again. We don't know what the details of that bill are. She's hoping that what will be different about this time is that she can talk to insurance companies who have a higher estimate of about $7.68 per member per month about whether or not that's realistic and whether or not there's a way to get that down. Part of the reason why this bill failed over and over and over again is because Democratic lawmakers couldn't agree or find a way to reduce the amount of financial burden on sort of just general insurance plan members across the state, because that would mean maybe taking off state employees. Maybe state employees don't get coverage, but then that doesn't feel fair. Or maybe you can take off fertility preservation treatments, but that means that folks who are going through cancer treatments, they will not have coverage for making sure that they can go through IVF later by freezing their eggs. And so no matter where you try to trim, someone is losing. And so Democratic lawmakers just truly could not agree on a way to make it cheaper. And so now they're just trying to see whether or not they can make those estimates, in their view, more realistic.
All right. Alexis Wiesen covers business for the Seattle Times. Thanks so much for your reporting.
Yeah, thank you.
Thanks for listening to Seattle Now. Take a minute to rate and review the show on your podcast app. Today's episode was produced by Andy Hurst. It was edited by Caroline Chamberlain Gomez. Our production team also includes Vaughn Jones, Brooklyn Jamerson Flowers, and Paige Browning. Greg Kramer does our theme music. Seattle Now and KUOW Public Radio are members of the NPR network. I'm Patricia Murphy. Talk to you tonight for Evening Headlines.